If you are over 60, the pill that could be stressing your heart may not be the one you worry about most. It may not be your prescription bottle. It may be the little tablet you take for knee pain, the cold pill you grab when your nose is stuffed, or the sleep aid you use because you were awake at 3 a.m. And that is exactly why this matters. Some of the most common pills older adults take can quietly raise blood pressure, disturb heart rhythm, cause fluid buildup, or clash with medicines you already need. Not because they are always dangerous for everyone, but because after 60, the body changes. Your kidneys may clear medicine more slowly. Your heart may be more sensitive. And the more pills you take, the easier it is for hidden risks to build up. I want to talk to you today the way I would talk to someone in my own family. Calmly. Clearly. No panic. No scare tactics. Just the truth in simple language. Because medication safety for seniors is one of the most important parts of protecting heart health after 60, and it is often the part people miss. Many viewers tell me the same thing. They say, "Dr. Amelia, I only take what the label says." Or, "It's over the counter, so I thought it was harmless." Or, "I've taken it for years, so I didn't think it could suddenly be a problem." That makes perfect sense. But here is the part many people miss. The risk is often not one pill by itself. The risk is the timing, the dose, the combination, and the fact that your body at 68 does not handle medicine the same way it did at 38. Today I'm going to walk you through 5 common pills that can be tough on the heart in older adults, especially if you already have high blood pressure, swelling, kidney trouble, heart disease, atrial fibrillation, or a history of dizziness or fainting. And please stay with me, because later I'm going to share one very simple habit that can help you catch a hidden medication problem before it turns into a trip to urgent care. It takes only a few minutes, but it can protect your heart, your balance, your memory, and your independence. If this topic matters to you, tell me your age in the comments, or share one medicine that has ever made you feel dizzy, foggy, puffy, or just not like yourself. And if you want more easy-to-follow videos on senior health, blood pressure, heart health, memory, walking, sleep, and healthy aging, please like this video and subscribe. That helps this channel reach more older adults and caregivers who need calm, trustworthy support, and it helps me know what you want me to cover next. Let's begin with a pill millions of people take without a second thought. Common pain relievers like ibuprofen and naproxen. People use them for arthritis, back pain, shoulder pain, headaches, hip pain, and those everyday aches that seem to come with aging. On the surface, they seem simple. Take one, feel better, move on with your day. But over 60, these pills can put real strain on the heart. They can raise blood pressure. They can make the body hold on to fluid. They can also interfere with some blood pressure medicines and make them work less well. That matters because when more fluid stays in the body, the heart has to work harder. When blood pressure creeps up, the risk can rise quietly, especially if you already have heart failure, kidney disease, or swollen legs. Think about a common situation. A man in his late 60s has sore knees, so he starts taking a pain pill most days. A week later, his ankles look puffy. He feels more short of breath going up the stairs. He thinks it must be the weather, or maybe he is just tired. Then he checks his blood pressure, and it is higher than usual. That is the kind of everyday story that can happen so easily. It does not mean every pain pill is wrong. It means older adults need to use these medicines with more care and ask whether there is a safer option, a lower-risk plan, or a better way to manage pain. Now this is important. Sometimes the problem is not just the pain pill itself. It is the hidden pain pill inside another product. Some nighttime pain remedies combine a pain reliever with a sleep ingredient. Some cold medicines also contain pain relievers. So a person may think they are taking one medicine when really they are stacking 2 or 3. That is where trouble can begin. If you have heart disease, high blood pressure, kidney problems, or sudden swelling, it is wise to review all pain products with your doctor or pharmacist before using them regularly. The second pill group is one that shows up most often during cold and flu season, and many people do not connect it to heart danger at all. Decongestants. These are the pills that help when your nose is stuffed and your head feels full. Ingredients like pseudoephedrine can shrink swollen blood vessels in the nose so you feel less congested. But the same effect can also raise blood pressure and make the heart work harder. In some people, it can trigger a racing heartbeat, jitters, or a feeling that something just feels off in the chest. That matters even more after 60 because many older adults already live with high blood pressure, take medicines for the heart, or have circulation problems. I want you to picture a very ordinary moment. You catch a cold. You want relief fast. You grab a severe sinus pill from the store. By evening, your blood pressure is higher, your heart feels like it is pounding, and you cannot understand why. The reason may not be the cold alone. It may be the decongestant. That is why if you have heart disease, uncontrolled blood pressure, atrial fibrillation, or you've been told to watch your pressure closely, you should pause before taking these products and ask your pharmacist which cold relief options are safer for your heart. And here is another small but powerful point. Many decongestants are tucked into combination products. Daytime cold, nighttime cold, sinus pressure, head congestion, allergy and cold. If the front of the box promises relief for everything, turn it over and read the active ingredients. That one small habit can save you from taking a medicine your heart really did not need. The third group is one of the biggest hidden troublemakers for older adults, and that is diphenhydramine. You may know it as a nighttime allergy pill, a sleep aid, or an ingredient in many PM products. A lot of people over 60 take it because they cannot sleep, they feel itchy, or they want relief from a cold at night. But here is the truth. Diphenhydramine can be rough on older adults. It can cause next-day drowsiness, confusion, dry mouth, trouble urinating, blurry thinking, and poor balance. And in some people, it can cause a fast or irregular heartbeat. That is not something to brush aside. I see this pattern often. A person takes a PM pill because they slept badly for a few nights. The next morning, they feel groggy. They stand up and feel dizzy. Their mind feels cloudy. They are more unsteady in the bathroom, more likely to stumble, more likely to feel their heart flutter. They think, maybe I'm just tired. But sometimes it is the medicine. And after 60, those side effects can hit harder. That is one reason many experts say diphenhydramine is usually not the best choice for older adults except in very specific situations guided by a professional. If you rely on a PM pill often, it is worth asking whether there is a safer way to handle sleep or nighttime symptoms. But there is another reason this matters for the heart. When a pill makes you groggy and off balance, it does not just affect sleep. It affects falls, blood pressure swings, confusion, and that shaky, unsettled feeling that makes a person lose confidence. One bad night can turn into a bad morning, and a bad morning can lead to a dangerous fall. So when we talk about heart health after 60, we are not only talking about chest pain. We are talking about the whole chain of events that a risky pill can trigger. The fourth pill may surprise you even more. Some antacids and fizzy heartburn remedies, especially the ones that contain a lot of sodium, can be a problem for people with heart failure, high blood pressure, swelling, or kidney disease. This catches many people off guard because they think of heartburn medicine as something that stays in the stomach and does not affect the heart. But some of these products bring in extra sodium and sodium makes the body hold on to water. More water means more fluid. More fluid can mean more swelling, more strain on the heart, and in some cases more shortness of breath. This is one of those hidden senior health risks people almost never talk about. A person carefully avoids salty chips, canned soup, and fast food because they were told to watch sodium. But then they take a fizzy heartburn remedy several times a week and never realize that the medicine itself may be adding to the problem. If you have ever noticed your shoes feel tighter, your fingers look puffy, your weight jumps up quickly, or you feel more breathless after a stretch of stomach trouble, do not ignore that. Bring the product with you and ask your pharmacist or doctor to check it. Not every antacid is high in sodium, and not every person will have this issue, but after 60, it is one more hidden place sodium can sneak in. The fifth group is a little different, because it is usually prescribed for a short time, not taken every day. Certain antibiotics can affect heart rhythm in some people, especially older adults who already have heart disease, low potassium, low magnesium, or who take several medicines at once. One example people often hear about is azithromycin. Let me be very careful here. This does not mean the antibiotic is bad or that no one should take it. Many people take it with no major problem, and sometimes it is the right medicine. The key is that some people are at higher risk for rhythm problems, especially if they already have an irregular heartbeat, or take other medicines that can affect the electrical system of the heart. That is why this is so important. When you are sick, you may be focused on clearing the infection. You may not think to mention that you have atrial fibrillation, fainting spells, a history of palpitations, or that you take several heart medicines already. But those details matter. Before starting a new prescription, especially if you are over 60 and already on multiple medicines, ask one simple question. Is this safe for my heart rhythm and my current medication list? That one sentence can open the door to a safer choice, extra monitoring, or just peace of mind. Now let's make this even more practical, because knowing the 5 pill groups is only half the battle. The deeper problem is what I call the quiet stacking effect. A pain pill for the knee. A cold pill for the nose. A PM pill for sleep. A heartburn tablet after dinner. Then your regular prescriptions on top of that. No single choice may seem dramatic, but together they can create dizziness, swelling, pressure changes, rhythm problems, or kidney stress. And the body often gives small warning signs before it gives a big one. So what are the warning signs many older adults ignore? Watch for swelling in the feet, ankles, hands, or face. Watch for a sudden jump in blood pressure. Watch for a pounding heartbeat, fluttering, skipped beats, or a strange racing feeling in the chest. Watch for dizziness when you stand up. Watch for sudden confusion or unusual sleepiness. Watch for shortness of breath that feels new or worse than usual. Watch for a quick weight gain over a few days, especially if your legs are puffy. These signs do not always mean something serious is happening, but after starting a new pill or combining several products, they deserve attention. I want to pause here and tell you something encouraging. You do not need to memorize every ingredient in the pharmacy. You do not need to live in fear of medicine. What you need is a system. A simple routine. Something easy enough that you will actually do it. And here is the habit I promised earlier, the one that may help you catch a hidden medication problem before it becomes a crisis. Keep one complete medicine list and update it every time something changes. I mean everything. Prescriptions. Over-the-counter pills. Vitamins. Herbal products. Sleep aids. Pain relievers. Cold medicines. Heartburn tablets. Put the name, the dose, and how often you take it. Keep one copy at home and one in your wallet or purse. Better yet, take a photo of your bottles on your phone if that is easier. Then at least once a year, or anytime you have a new symptom, do what pharmacists sometimes call a brown bag review. Put all your medicine bottles in a bag and bring them to your doctor or pharmacist. Let them look for duplicate ingredients, risky combinations, and products that may no longer fit your needs. This one step can uncover problems that people miss for years. Here is the part many people miss. The front label is often marketing. The active ingredient list is the truth. 2 products with different brand names may contain the same drug. A sleep aid may contain diphenhydramine. A sinus pill may contain a decongestant. A PM pain medicine may combine a pain reliever with a sedating ingredient. So if you are only reading the large print on the front, you may think you are taking separate harmless products, when in fact you are repeating the same ingredient again and again. That is how people end up saying, "I only took 1 extra pill," when really it was more than that. And please do not stop any prescription medicine suddenly because of this video. That is very important. Some medicines need to be adjusted slowly and carefully. Some are protecting you in ways you may not feel day to day. My goal is not to make you afraid of your treatment. My goal is to help you ask better questions, notice warning signs earlier, and use over-the-counter medicine more wisely. If something in today's video sounds like it fits your situation, bring it to your doctor or pharmacist and review it together. If you have chest pain, fainting, severe shortness of breath, sudden weakness on one side, trouble speaking, or a fast or irregular heartbeat that feels severe or will not stop, seek urgent medical help right away. Those are not signs to watch for tomorrow. Those are signs to act on now. Quick care matters. I know this can feel like a lot, especially if you already take several medicines and you are doing your best just to keep up with daily life. But let me leave you with this. Growing older does not mean giving up control. In many ways, it means becoming more thoughtful, more observant, and more protective of your own body. Small choices matter. Reading the active ingredient. Checking your blood pressure after a new medicine. Asking your pharmacist before buying a cold pill. Looking at sodium in heartburn remedies. Avoiding nighttime pills that leave you foggy the next morning. These are small actions, but they can make a very big difference in how steady, clear, and strong you feel. The goal is not to take no medicine. The goal is to take the right medicine in the safest way for the body you have now. That is how you protect your heart. That is how you stay independent longer. That is how you lower the risk of falls, swelling, confusion, and those scary moments when your body suddenly does not feel like your own. And that is why this topic matters so much after 60. If you found this helpful, please share it with a spouse, a parent, a sibling, or a friend who keeps a weekly pill box and may not realize that the real danger can come from the extra pills taken on top of it. And tell me in the comments which one surprised you most. Was it pain pills, cold medicine, PM sleep aids, heartburn remedies, or antibiotics? I read those comments, and they helped me create the next video with you in mind. Take care of your heart, be kind to yourself, and remember that sometimes the safest change is not a big one. Sometimes it is simply asking one more question before you swallow the next pill.